right now we are facing the prospects moving forward over the course of the next number of months of moving into flu season. Time for flu season, of course, puts tremendous stress and demand for testing. People that develop flu-like symptoms are going to understandably and likely request that they get tested not only for flu, but also get tested for COVID-19. In anticipation of some of the stress that will place on our testing system, in anticipation of addressing some of the existing and persistent challenges with getting timely test results, as well as providing the kind of access, the quality access that provides for a lens of equity in terms of the testing, we're moving now in a new direction. We have averaged roughly 100,000 tests every day in this state. You saw a few weeks ago it was over 132,000. We've been challenged by this heat wave and by these wildfires. We're currently averaging, current average is anywhere from 5 up to 7 day turnaround on the test. Each and every day is a precious day in terms of the test results. Once you get past a few days, those test results lose their resonance, lose their meaning and significance in terms of our capacity to mitigate your exposure, mitigate the spread of the disease. The average cost of what we refer to as a molecular diagnostic test, these are the PCR tests that many of you are very familiar with. The average costs of those tests is $150 to $200. Which is quite significant. Just consider the state of California has done just shy of 11 million tests. You can pull out your calculator, do the math on 10.8 million tests, averaging anywhere from $150 to $200, the extraordinary cost of that diagnostic. We have formalized a partnership now with Perkin-Elmer to build out a new laboratory here in the state of California, with Perkin-Elmer's capacity to provide the full supply chain in terms of the reagents and the roughly 20 different ingredients that go in to a test. The state will be accountable for logistics and billing. We have other work that we're responsible doing, but this provides us the ability to have much more stability and the ability to provide more reliability to people that are at risk, essential workers, to address the issue of the supply chain constraints that we think will only grow, not diminish, into the flu season. California is committing to a diagnostic testing partnership that will provide an additional 150,000 tests per day. So we're averaging over 100,000 tests a day. We were doing well north of 130,000 before the wildfires. We'll get back up into that range very shortly. This is additive. It's not a substitute. All the existing testing protocols that are currently in place, all the partnerships that we have advanced with our labs up and down the state and some of these more mobile testing sites, we are only looking to disrupt the costs of that system, but not the access to those tests and those diagnostics in the existing system. But we want to add on top of it. But what is significant in this partnership is we are demanding test results back within 24 hours, the latest 48 hours, and we have provisions in the contract to guarantee that turnaround time. You get in within 48 hours, certainly within 24 hours, then we have the ability to make decisions in real time that will advance our efforts to reopen our schools for in-person education, reopen our businesses in a more effective and efficient manner, in a more sustainable manner. Here's the new cost breakdown. Again, $150 to $200 was the average per test. Under this new partnership, our cost breakdown works accordingly. For up to 40,000 tests, the cost per test will be $47.99. So let's just take the lower end of the average. That's a third of the cost on the lower end of the average current costs per test, 1/3. If we get our tests up to 100,000, that price drops from $49.99 to $37.78. And if we reach that 150,000 testing capacity, which is part of this contract, we'll get the tests down to $30.78. So the goal is to get down cost of tests that are averaging $150 to $200, costing you directly and indirectly as taxpayers and as people that have gotten the diagnostic test through your employer, through your insurance, or through taxpayer-subsidized insurance, up to $150 to $200 to bring those costs down to a little over $30 a test.